Welcome back to Dishing with Patricia. It's been a while. Today, I'm going to talk about a very serious subject. I've chosen to discuss Black maternal health. Why I have chosen that? It's time. It's past time. So I've chosen to talk about it today. What we do know about Black maternal health, Black women die 3 times more than any other race or ethnicity of people. Multiple factors contribute to that. Underlying chronic conditions, structural racism, implicit bias, social determinants of health. All of these are preventable. Did you hear what I said? Preventable. My guest today is Sundé Daniels. Sundé is the lead for training at the Center of Black Maternal Health and Reproductive Justice at Tufts University. Sundé, thank you for coming. Did I get it right?
Yes, that's part of it. I'm actually the center manager and the managing director, as well as the education and training unit lead for the Center for Black Maternal Health and Reproductive Justice.
That's a mouthful. I love it. I love it. Sundé, tell us your story.
Sure. So I was originally working at another center here at the that falls under the medical school. And one of our mutual colleagues, I should say our being Dr. Ao, who is the founding director, and she is the main force behind all of this, asked me to come and help start the center. And that was in 2022. And August is when I started. My background is in biochemistry, business, law. And so it kind of worked out because I had a lot of the different experiences and understandings that were needed in order to start the center and to make sure that we continue to be successful in what we're looking at trying to eradicate, which is this crisis of Black and brown women not receiving, fair, I guess they're not receiving equal or just opportunities in the area of birthing.
It's more than just a crisis. It needs to be, I always say, if not now, when?
That's right. And that's what our saying, we have a huge, beautiful framed wall hanging that says, if not us, then who? And if not now, then when?
Yes, I feel the same way. I know the center has a conference coming up.
Yes.
It's your 7th annual conference, and this time is going to be virtual, correct?
Yes.
Can you tell me about it, please?
Sure, absolutely. So our conference is the nation's largest Black maternal health conference, and it's convening on April 5th and 6th. This year, we're looking at the role of tech in Black maternal health. So we'll be having several speakers speaking about various apps that they have built specifically aimed at Black maternal health and that journey. This year will be virtual. And we did that specifically because it is centered on tech. So we wanted to give that opportunity, to be wider than just in person. And hopefully it's going to reach more people.
Right.
As many as we can reach.
A greater audience.
Yeah.
Tell me a little bit, who conceived, Doctor, did she conceive this conference?
Absolutely. So this was when she first arrived here at Tufts, she spoke to her, I believe it was the chair at the time, and said, I'd love to have a conference. And she gave her this little bit of money, and she's like, here, but I don't think anybody's going to come. And when I say a little bit of money, it was maybe a couple thousand. And they packed an auditorium. It was absolutely packed. And she's been doing that now for the past 6 years. She's been doing it, and it's gotten bigger. And now it's housed and falls under the center.
That's just wonderful.
Yeah.
Tell me a little, I've read about who the speakers are going to be.
Yes.
And some of the apps are phenomenal. It's kind of like, I love the aspect that it's kind of like when you go to buy a television, you look at reviews.
That's right.
You go
Right.
to a doctor, particularly what's going on here. So tell me about some of those apps, some of the
Sure.
speakers, because this is going to post prior to your conference, and I
Okay.
want people to get excited, and they'll have a little bit of knowing what's going to happen.
Absolutely. So Kimberly Sells Ehlers she's the founder and CEO of the Earth app, which is she's going to be our keynote speaker.
Okay.
And it's Earth, IRTH, as in birth, but drop the B for bias. And it's the only app where you can find prenatal, birthing, postpartum, and pediatric reviews of care from other Black and Brown women. And it's considered to be like the #1 Yelp-like platform for the pregnancy and new motherhood journey. And it's made by and for people of color. That app helps women have a more safe and a more empowered pregnancy and parenting experience, allowing the mom to see how other parents of color experience care at a hospital or care at a doctor's office. And then they turn all of those collective experiences into data that's meaningful, and it helps push for change in that health system or in health systems across the country. We have 2 panel presentations. One of the founders is Navigate Maternity, which uses data to support patients and providers throughout the prenatal and postpartum experience for an equitable and culturally competent journey. And the other is Frame Fertility, or I'm sorry, there's a couple others. Frame Fertility, Poppy Seed Health, Mommy, and Woolomi. And these platforms are about data, evidence-based approaches to care. They really cater towards building a community to support birthing people. So it's a place where you can find other people who are, experiencing some of the things that you're experiencing.
And one of the apps is RealTime.
Yes.
I like that aspect of it, because in doing some of my research, you're presented in a situation that you don't know what to do, and you're feeling pressured. They want you to go this way, you want to go that way, and you don't have an advocate, and you don't have anybody that gives you the confidence that you need to say, no, I don't want to go that route. Tell me about that app. I like the idea of that one.
So that app is in real time. It does, real time, I think now with the advancement of technology is really important.
Yes.
I think that, to have real time, I think really changes the birthing experience. For so long, it's been word of mouth. And now you're actually getting something that's right at the moment. You see what's happening. And that really, I think that changes. I mean, you have a new generation that's coming up, or various generations that are coming up, and you don't always have the ability to hand down any stories or any intel on this is how you can do it. But to be able to be on an app, to hear other people, to be able to put your information out there, I think is great. I think it's, I think we can, it helps people who are gathering data and then siphoning that data and composing an observation. I think it's really helpful because you're getting stuff that isn't, I heard, or there was a story. It's actually happening.
Right.
Data from that.
It's a game changer.
Absolutely. It's a huge
game. Yes, it's a game changer. I really like the aspect of you guys going digital, because we have to embrace time is changing. And not only that, you're able to reach a larger audience with it being digital. You're also going to feature a film. Tell me about this film.
So we're going to be featuring a short film. It's the premiere of a film, and it's entitled Black Motherhood Through the Lens. This film focuses on the birthing experiences of 4 Black women from conception to postpartum. The women in this documentary have experienced things from miscarriage, lack of access to infertility care, fears about childbirth, and postpartum depression. These women have, been so amazing to be willing to be filmed and to tell about these spaces that are uncomfortable, and, retelling it is almost like reliving it. And so I find this film, it's not super long, but I think it's very insightful because it's from it's literally from their mouths, right? It's not edited in a way that they're piecing together their story. They're truly telling their story and what their experience is. So it's going to be on April 6th at 4:45. We're going to start. And I'm really excited because we're going to feature the film, but also have a in-person discussion with the filmmaker and then 3 of the 4 moms that are featured in the film.
Also, you have a team of physicians, and also they're part of your speech.
It'll just be one. It'll just be one. The filmmaker, she's actually a resident at UPenn. She's an OBGYN resident. And she's the one who filmed this film. I think it was like a little bit before COVID she started, and then, through COVID is when she finished it.
Tell me, what difference has the center made since its conception?
So that's a great question, right? So when you sit down, you always want to have measurements of success, right, or measurements of completion. And because we're not this like boots on the ground activist type of center, we're more on the think tank side. Measuring success for us is being able to disseminate the information and get the information out there. So we don't necessarily have, okay, check off, we've done this is successful, right? And I mean, the reality of this crisis that's around Black maternal health, that's, facing these Black and brown moms, like the root of it is racism, right? And you can't eradicate racism. Racism is a hard issue. However, we can give this information to help make changes that are going to enhance and make better these birthing experiences. So for us as a center, looking at what success is, it's waking up every day, getting this information out to the people in the world. And that can be finishing a paper, publishing a paper, giving a conference, giving a talk, even people coming to us and us redirecting them to a place where they can get help. We've had people call, they need a doula, they need a birthing center, they have questions. And like I said, we're not necessarily boots on the ground like a community center, but we definitely are able to connect those in our community to places where they can get support. And for us, that's success. For us, being able to be in this space is success, because this didn't exist before and now it exists, and now we have the opportunity to support and help other people in this journey.
So if you had a genie in a bottle and I'll give you only one wish. I'm not going to give you multiple wishes.
Oh.
I want you to have one wish. Tell me what that wish would be, and how do you think you could change things based on that wish? Because you don't have a lot of, of course, maybe I'll give you a wish that has 2 parts to it.
Okay, I like that. That's fair. That's fair. I can play with that. So my wish would be that we'd have the necessary funding to complete our strategic plan or the itemized things that we feel are necessary to get this crisis under control. Because what I've found in my time being here and studying the Black maternal health crisis and the experiences that I've had, my own self within my family, to fix this, it takes a lot of money.
Yes.
It takes a lot of money, and because it's in a space that people don't see, because the first thing, if you're on the outside and you don't really know, you think to yourself, well, if it's clearly biased, why don't people just learn to be more encompassing? But it's not, people aren't that simple, right? It's not that simple. So we have to train, right? We've got to write white papers and publications and disseminating that not just to researchers and to doctors, but getting it down so that the average people can hear it, the nurses that are on the floors with these moms, the doctors, the patient care people. That takes money to disseminate that. So I think if I had the money That would be my first wish, would be the adequate funding.
Okay.
The reason why I don't say unlimited supply is because my goal is to fix a problem, right? If I need enough to fix a problem. The second part would be the ability, the manpower to do just that, which is to disseminate this information so that people can change. They can make changes. They can put effort into changing, because oftentimes what I'm finding is that given how the world is moving so fast with technology, that when it's very interesting that when people know better, they start to do better.
Right.
There's no excuse, right? You've got all these platforms. You've got your TikTok, your Facebook, your Instagram, everything in the world, right? But they're getting access to the information and they're being able to do better. So if I had the money and then had the manpower to put it out there, those would be my two wishes. That would be part A and part B.
So I was just looking down a little bit because we're doing a report, our company, on maternal health. So I've been able to get some data, but one particular thing stood out to me, one of the recommendations by the NIH. But one time I was reading something about structural racism in the New England Journal. And he said that it's past one of the comments was that we're having too many discussions and we're not getting any results. And I was like, wow, we're not getting any results. But one of the recommendations from the NIH, fund and implement a maternity morbidity and mortality prevention moonshot. I had to look that word up. I said, moonshot.
Wow.
Right. And their last quote, and not to say I love I'm not a scientist, but since I've been doing research, NIH just really kind of just knocks it home on things. And one of the last was, it said that, oh God, okay, hold on, it says, the recommendations do not need to await the results of further research to justify and implement the appropriate federal and state agencies. Did you hear what I said?
They are not wrong. They are not wrong.
Okay.
This is typical research, right? So it's not your typical research project where it's like, okay, let's do a little bit and see if it works. Like it's very evident that these things are missing. So do that. Keep researching, right? Like
how much research you do, how much research you need. That's just like, we know that some data I'm looking up on my report. The last time I got it was the latest update could be 2018. Okay, this is 20. So I can't wait, but I love the idea, and I'm not I guess I'm giving them credit. So if you guys hear this, you all need to help give some money. Moonshot. That's like, go, stop waiting.
That's right.
How many more women have to die? But not just, people don't know the statistics. They hear about mothers, but they have no idea how many babies are dying.
No, yeah, nobody, I'm sure there's probably a statistic out there, but it's not one that's necessarily put to the forefront. I was going to say, one of the things that they don't mention, right, in Black maternal health, that crisis is about visiting the doctor and the care and the birthing experience. But there's another part to that, which is about dads and fathers and partners, right? And, people, that's another. I know that there's information, there's statistics that are driven from the interest in that, just something that people don't talk about. That's actually going to be our conference focus for next year, is the role of fathers in Black maternal health. But that's another piece of it that people aren't talking about, but I think we'll start to see more of is that role and how they play and how important that is, and that men too suffer postpartum depression.
Correct. That is your support.
Yes.
One of the things that the March of Dimes talks about maternity deserts. So we know that people don't quite understand, and how they want to blame the mothers for, had she gone to the doctor, she would have had, okay, well, there's no doctor where I live. And then when I get there, they don't take my insurance.
Correct. It's a problem. It's a bigger problem than people think about. Like, you don't, you don't intend to have a baby and not have a place to give birth or not have a place to get care. Nobody says like, okay, well, let's start a family now. Let's sit down and plan. Is this a maternal health desert or not? I mean, people don't even know that that's a word that exists, truth be told, right? Most lay people on the ground, they don't know. They're just like, okay, we're gonna have a family. It's gonna be great. Of course I can get out. There's a hospital nearby. And you go and they don't take your insurance, or they have to call the person who can deliver the baby and they live far away. It's terrible. And it shouldn't be like this. This is America. We don't have an excuse.
We don't have excuses. No, it costs more to have a baby in the United States than any other country, but we have the poorest results.
Absolutely. It's crazy.
So, what are some of the things as a layman, a person as myself, I'm going to use my platform as much as I can to get this word out. Well, what can the average person do to help? You need help. What can we do?
I believe the average person can identify places that are around them where they can volunteer, where they can see if there's places to donate things to. A lot of people don't realize that oftentimes when you give birth in the hospital, they give you 1 or 2 days and they give you, the hospital blanket and hospital pacifier and send you on your way. And oftentimes many people don't realize that they need diapers or extra diapers, or that they're going to need, they have to breastfeed, or maybe their baby doesn't take the breast milk. And so they go places, sometimes they don't have the money necessarily to get things that are a little bit more expensive to help feed their own children, or they need Pampers and they don't realize that how expensive they are and they only have a limited supply. So I often encourage people to find some place where they can donate. There's many places, ironically, as much as we have maternity deserts, there are places where you can donate in those areas to support that. And also going in and seeing, contacting your local hospitals or local birthing centers to see if there's a way that you can give of your time, or if you have the means, any, financial means to give a little something. And a little something goes a long way. People often feel like, oh, I don't have a lot of money, so I can't. You can go and buy a package of Pampers and donate them to somebody. And that's huge to a family that doesn't have it, or they've had a problem with the birthing experience. And so they're paying for that. They have to also take care of the baby that's arrived now at the same time.
So some basic needs. So
basic needs.
What we'll do is I'll reach back out to you. So when this airs, we'll have a little chyron that'll give some suggestions for people.
Absolutely. I'd love
that. Not a problem at all. We're here to help. We're here to help. So
thank you.
What about, I am very big on, I like the idea that community health is back on the rise. I think that community health will allow patients to have a voice. Absolutely. Their doctors will be able to see them, whether the doctor is Black or white or whatever race is. If you are in a community hospital, community health center, you are consciously making a decision that you want to make a change with your patient. So what else would you recommend other than, quote unquote, the traditional hospitals where mothers can give birth that will cut out some of this, we know, preventable deaths?
So there's oftentimes you find birthing centers. It's not just a hospital, there's birthing centers. There's groups that aren't necessarily brick and mortar, but there's often groups of doulas and midwives, and they often know in other ways that can be helped because they're literally boots on the ground, right? They're helping deliver these babies and helping moms through this journey. So contacting those groups would be another way to find out how you can help, as opposed to just going to the hospital. There are many small birthing centers. Yeah.
So I know what a doula is. Please explain that, because I want my audience, some of them that don't know, I don't want them to assume to know. So that they have options. So please.
Absolutely. Doulas are becoming now more and more, they're now being elevated to the level at which they should have always been, right? And so typically doulas are a man or a woman. There are men doulas that are there that many times people don't know, but they're trained professionals, and they will offer emotional and physical support to a mom before, during, and after childbirth. Doulas have deep roots, many generations of coming and supporting in that space. And doulas are in many spaces, not just childbirth, but a doula can help you before you get, before you give birth, during the birth, and after the birth. I mean, doulas do things coming in and helping the mom cook the dinner, help with the second kid, putting the child down at night, wherever that mom needs help, that doula is there to support them in that space. A midwife is a midwife is medically trained. So she does a bit more. She can actually help, he or she can actually help give birth. They're trained to help actually give birth. So it's not just the emotional or physical support. They can aid or help deliver a baby. They will help also pre and post. They provide care as well, but they are medically trained, and often, they're considered nurses. Many midwives are nurses, but they do a little bit more than doulas do.
I know that this has not been a subject in the forefront of a lot of our, in the government, the legislators, but I know that the White House has come out with their recommendations. Some of the largest agencies in our federal government have come out with some suggestions. How quickly do you think some of those things can be implemented?
Well,
how can we help bring about the change that is needed?
I mean, you can do your obvious things. I think that people often miss is when you have an opportunity to vote for something that's positive in that direction, give it a positive vote, right? And I think that, the government has all this red tape. So realistically, these things can happen quickly. It doesn't take a lot of time.
Yeah.
Some things take time because you have to put things in place, and that means putting people in place. And I want to give credence and, understanding that it does take time to make some changes because you have to have bodies in places. But I think we're definitely closer than we were 10 years ago, because now it's a priority. Now it's important. Now it's on the quote docket, if you will. Everybody's aware of it. So there's no excuse for things not to be started and to start moving. But, I've been asked before, like, oh, how long do you think it is before we can fix this? I don't think we have a timeline, but I do believe that everything that we can do can start now. We can start, right? We can start now. There's no excuse not to start doing small things to help make changes and to help changes happen.
Okay. Before we close, I have two things I want you to do. This is your commercial. Tell us about Black maternal health.
So, wow, I didn't think I was going to be put on for a commercial.
My platform is to help Black maternal health. You are absolutely right here talking to me about it. So tell them why they need to be concerned about this.
Absolutely. In the US, Black mothers are 3 to 4 times more likely to die from pregnancy-related complications than their white counterparts. And this should really concern everybody. Like, that's not good. We as a country should be embarrassed that there shouldn't be any difference, right? And so we should all be concerned about it. It's shame, right? And it's important to know that more than 80% of pregnancy-related deaths are preventable. Like, that's mind-blowing to me. And it's not okay. Like, again, that's not okay. We should be embarrassed. There's many needs related to resolving Black maternal health. As you had asked me earlier, there's several disparities. My question typically is like, how much time do you have, right, to talk about how many needs and what the disparities are? But there's three things that I think that have to happen for us to really start to reduce those Black maternal health equities. We need to have physician and clinical champions within this maternal health space who are willing to do the work and hold their colleagues available, right? So they have to be able to come to the table and want to deepen their training and their expertise as it relates to being culturally humble, culturally sensitive to working with diverse patient populations. I think the second thing is it's about the data, right? So we need clinically accurate data that's publicly available so people can see it, read it, make recommendations in real time, and be able to interrupt some of what's happening, the severe maternal morbidity. We can interrupt it simply with some data and making changes based on that data. And that's everywhere across the country. And I think thirdly, I would say an acknowledgement of racism as part of the history of the discipline. And, I believe that you can't know where you're going unless you know where you've come from. And here to relate that is we can't resolve these disparities unless we understand the root cause and we intervene on the miseducation that's still happening within the field of OB. It was founded on the principles of dismantling and respecting bodies of enslaved Black women. And that was not so distant. That's fairly, recent. It's not like, oh, that was like 700 years ago. No, it was more recent than that. And so it's not a surprise that we're in a situation that we're in. However, knowing that racism is deeply embedded into the field of medicine and, how we train our clinicians, we can make a change. We just need to acknowledge and unpin the bias practices, right? If we can start reversing those, I think that's a great way that we can start making those changes.
Bring about change.
Absolutely.
I mean, you have to acknowledge it. It does exist. You can no longer deny it. We know it. How can we donate to the center?
So I have a link that I will give you that you can share. Thank you for asking. But we, people can contact us. We take any forms of payment. We're on this journey. So anything that spins in this country, we're willing to take to support what we're working towards. But I'm happy to share with you a link where people can donate. And like I said, any amount, we often have people who give $5, $10. That is a lot for us because that's 5 makes 10, 10 makes 20, etc. Right? Yeah. So the more we have, the better off we're going to be. And as we continue to storm forward in trying to help change and eliminate the disparities.
I just thought about something.
Yeah.
With your conference coming, if there was a church, for instance, that had maybe about 30 members that would be interested in seeing this, can we arrange for something like that?
Absolutely.
Church, they don't have the monies to be an ally or any of those types.
Absolutely.
Okay.
Just being able to educate groups like that, absolutely contact me, contact me at the center, and we will make it happen. Okay. We want that information. We want people to know about it, to learn and to share with others and get involved however they feel moved to do.
Okay, so I'm going to put my money where my mouth is.
Love it.
And I'm going to find a church and I will donate 50 registrants to be able to see your conference.
Love it. That's exciting.
So I'm going to do that. So
thank you.
I don't like to ask people for things that I can't participate in.
Right.
I want to sell something that I don't believe in, and I believe bringing about a change. And I think we have to take this back to the grassroots. It starts in our communities. So I want to help give a voice. So I'm going to commit to 50. And
awesome. I love it.
Is there anything that you think that we have not discussed that you need to give this last pitch before we go?
I would just encourage people to educate themselves. I think that's really important, to know what's happening, to be aware. I'm not saying you have to study it deeply, but just to get an overview of what's actually happening. I mean, I'll be fully transparent and honest. Like I told you, my background is biochemistry. I'm a trained biochemist. That was what my first degree was in. I went and looked at business and at pharmaceutical business, drug development. So coming here, despite my own personal involvement in Black maternal health, coming here, I've had to educate myself, right? Further than, most the average layperson has. But I say that to say that there is information out there for those people who want to learn.
Okay.
You have to look a little deeper, but just searching Black maternal health and research and just learning some statistics, I think, is really important, because if you know better, you can do better. And so when those opportunities come up for people, they can say, I've heard about that. I'd like to do something to help.
I really thank you for agreeing to come on. This is an important issue.
So thank you for me.
I can't make a moonshot, but the word is out there that we need to moonshot this crisis. We can no longer wait. We're, this bucket that we keep tipping out, trying to save this boat, this ship, is not working.
That part. We need to moonshot. Everybody needs a bucket. And I think it's important. Everybody moonshotting in their own way. I think if we pull that all together, it's a bigger moonshot.
Sunday, thank you so much.